The reason why I joined Vision RT was I used the product clinically at the University of Maryland. Early in those days it was more of a research feature and I saw potential in it. In fact, a lot of my colleagues did as well, and we knew there was something to it. At the time it was a little bit clunkier to use. It's made a lot of improvements over the years, but seeing the potential in it from using it clinically, I knew that this company has big things on the horizon and I knew I needed to be a part of it. That is why I joined. Hi, my name is Brittany. I am a product manager and I've been with Vision RT for 4 years. Vision RT's products are important because they impact patients' quality of care. For hospitals that don't have Vision RT products, the amount of time the patient's in the room and the amount of effort that the therapists have to put into aligning the patient is extended, and that is a great aid to have in the radiotherapy environment is our product to make it a quick and easy process for the patients and the caregivers. Out of therapy school, I joined University of Maryland where I worked for 6 years and I was a senior radiation therapist there. At times, the co-founders of the company would come and visit us at the hospital, and I remember walking into one of them and saying, "I think I want to travel the world and train people on using your product." So fast forward a couple of years later, we were having one of our systems moved from an older vault to a new vault, and I had the opportunity to meet the director of customer support at that time. And rather than just say, "Hey, I think I'd like to travel and see the world and train your company," I basically said, "I'm giving you my resume." And then a couple months later, I joined as the third at the time clinical applications support specialist. In the 2 years that I was a clinical applications specialist, I got to travel the world. And growing up in a small town in North Carolina, I never really thought that I would be in northern Italy one day learning how proton therapy patients are treated and how our product is beneficial for that environment. So after being in ClinOps for 2 years, the company saw my skill set and I began to grow in the product management role. I would never have had the opportunity, more than likely, to have that much growth in my career in just 4 years. If I would have joined a larger company, I could have been lost in the numbers. But because I joined the smaller company, Vision RT, they were able to see the potential in me a lot sooner, and I'm very fortunate to now be in the role that I am, and I'm very happy that I made the decision and that Vision RT took me on. So one of the benefits that we saw when we used Align RT clinically was you didn't have to have a mark on the patient's skin anymore. At a lot of the radiation therapy clinics that I visited now and know of in the industry, they still tattoo their patients. And this isn't just, a little mark on their skin that is gone after radiation therapy is finished. This is a mark that is permanently on their bodies for the rest of their lives. So think of a breast cancer patient. Their scars may have started to heal and their skin reaction might have healed from the radiation therapy, but they're forever left with a tattoo right in the middle of their chest. So a low-cut shirt, you're always going to see that permanent reminder of what you went through. With Align RT, you don't need any marks on the patient's skin anymore, definitely not needing tattoos. So once the patients are finished with their treatment, they can go about their lives and live their lives to the fullest, not having these constant reminders on their skin anymore. Not only that, but when you align a patient with 3 or 5 points, it's not as accurate as it is when you have thousands of virtual points to work with. So having that actual additional information as a radiation therapist aligning the patient, you have the opportunity to get more accurate alignments, which reduces the number of repeat imaging you have to do to verify your patient position. So you get a better, more accurate alignment, no tattoos for the patient, and getting the patient in and out of the room is really important, especially in our field in cancer treatment. Every minute that they're in the vault with you is 1 minute that they're not with their family, and these are really trying times for our patients. So it is very valuable to have them in and out and with their loved ones. And also our technology doesn't require anything to be placed on the skin of the patient. So other options out there for tracking patients' respiratory motion, for example, requires a block or a box to be taped to the skin or a band to wear across their abdomen, and Aligner T has none of that. I worked as a sim therapist for a couple of years, and I know as soon as you start putting things on patients' bodies, they get a little self-conscious and it results in them wiggling around, moving, and being abnormal. So with Aligner T, there's none of that. The patient barely even knows that we're there, and it helps to get in and out of the room and keeping the patient comfortable at all times. Being product manager at Vision RT is great because you're not just tied to one area, even geographically in the business. When you're a product manager at Vision RT, you're going out to every single customer base. You're going to the top cancer centers, and not just in the US, but in the entire world. And having a clinical background, that's really helped me gain expert knowledge in the industry because I get to see how everybody is solving similar problems. And it's a very unique benefit that Vision RT has given me is to look at the market globally. Because we are still a smaller company, I have the freedom to go and see the problems all over the world and find out how Aligner T and Vision RT can solve the customer problems on a global basis. These are the best times to join in product management at Vision RT. We are growing rapidly. We're constantly thinking of new products to add to our portfolio. And because of that, you have the opportunity to come in and build a product from the ground up. I know a lot of more established companies, they have legacy products, and it might be more difficult to come in and manage a product that has so much legacy behind it. But here at Vision RT, the product is yours, basically, when you come in. There's a lot more of ownership from the ground up. So some of the benefits of being a product manager at Vision RT is you get to work with all of the best hospitals globally. So not just if you're in the US, you might work with the top hospitals in the US, but at Vision RT, we're on a global scale with our product management team. And you get to really work with the top-notch hospitals in the whole world. The culture at Vision RT is amazing. I worked at a university hospital setting, and we had a very tight-knit community, but it has nothing even on the culture here at Vision RT. It's a tech company, and it's really about figuring out what's the best way to solve all the problems, and we have to collaborate. There isn't usually just one person has the answer on their own, and that's what we do. It takes team effort, and the business has done really well to recognize that it takes the whole family, the whole team to come together to make the best ultimate solution. So everybody's voice is valued and heard and required to make the best products. The company's done really well when we've grown. So in 4 years, I was around in the 20s or 30s in terms of employee numbers. And I remember my colleagues at the time saying, "Oh, are you sure you want to go and work for such a small company? You might want to go work for," and they rattled off several names of larger companies. But I'm really fortunate that I made the decision to join a smaller company because, especially Vision RT, as the company has grown, it's bringing the people up with it. And it's been great at Vision RT because although I came in with one idea in mind as a clinical application specialist, I've been able to grow into the role that I have now because of my special skill set, and I have amazing mentors in the business that have helped build my skill set even further. And it'll be interesting to see what the next 4 years even bring, because the company does bring you up and builds people up as well. What do research people want to see or hear? Do they want to hear that you can be put in a box and given toys as much as you want and done, or that you integrate in with the entire organization more? I think some research people might want to have that and hear that there's community. Some people might want to also hear that if you want tools and to be put in a box and just tell us what you need and we provide them, then we can accommodate all aspects of work ethics and work requirements. And you might not see that at a bigger company. At a bigger company, you have to follow their ways of doing things, whereas here, if you work better off in a corner with your headphones in, we're gonna let you do that, as long as the work is good. So our product is really great because you can use it on any patient, anytime, any day. But there are certain cases where our customers see even more an advantage, and now patients as well. When it comes to breast alignment, it's really tricky. There's a lot of variables when you align breast tissue and rib area, and our product is amazing at giving a really accurate alignment to breast tissue. Now, taking a free breathing patient and aligning them is one thing, but when you add to the mix breath hold and the benefits of breath hold in radiation oncology for breast cancer patients is mainly for the left side of the breast. So if you have a left-sided breast cancer patient, by having them take in a deep breath and hold it, the area that you're targeting moves further away from the heart, because that is a critical structure on the left side. Our body can only tolerate so much radiation to our different body parts before it becomes damaged. And what is a compromise in the field is you have to do this risk-benefit analysis. I want to cure their cancer in their breast, but I don't want to give them so much that their quality of life is destroyed because now we've treated very sensitive cardiac tissue. Not only that, but we learned from a physician that the area of the heart when you're taking in that deep breath is actually called the widowmaker that can be in the radiation treatment delivery field for these left-sided breast cancer patients. So our product allows the patients to be treated without anything touching them, anything added to their surface at all, with that breath hold accurately, and make sure that every time every monitor unit of the beam is delivered, it's hitting the place that it is intended to go to. And because we know where the breast tissue is, and we can see in all 6 degrees of freedom, vertical, longitude, lateral, rotation, pitch and roll, all of the vital areas of alignment during the treatment delivery, we know that we are saying beam on when it's time to beam on. And that's been vital to patients' quality of care, to have that. If you don't have a line RT, you can still do breath hold, but I'm just gonna paint a picture of what that looks like. If you don't have a line RT and you want to do breath hold, you could just have an intercom and you're just saying, when you're ready, take a breath in and hold it, and then you just cross your fingers and hope that the patient's consistently taking the same breath in and holding it. But that's not exact, that's not scientific, and that could be kind of dangerous if you don't really know that you're treating where you are aiming the treatment to. Another option is to put a box on a patient's abdomen, and a camera that's infrared will track a box on their belly. But once again, you're looking and getting information from an area that's it's not the breast tissue. Our system tracks the actual breast tissue, so you can see exactly where you're supposed to treat, and you know by using a line RT that you're delivering it to the right place. Another option is what's called spirometry-based breath hold, and it is pretty stressful for a patient. The patient comes in, they lay down, and they have a tube in their mouth. They have a nose clip on their nose. A lot of times the nose clip falls off because they're ladies and they wear lotions and makeup and you can't keep it on. And then a lot of times they'll have a button to hold, and they have to remember to hold it in when they're happy and let it go if they become too nervous. And there's a lot going on with that. And I did use that system clinically, and we had a really hard time getting reproducibility in our port films, or making sure the internal matched properly for knowing that we were delivering radiation in the proper area. And a line RT solves that problem for customers. It allows the user to know exactly where that breast tissue is. And there's no tubes, there's no box involved, less to set up in the room. Once again, patient can get out and into the room and out much quicker, and it solves a lot of the problems in the industry. And we're all about making sure we're solving problems and making better quality of care for patients. So if you don't have A line RT and you're treating intracranial SRS, where you're delivering a really high volume, high dose of radiation near very critical structures. It could be near the optic nerve, for example. Then the industry would typically use bolts, and a neurosurgeon would have to come to the department. Patient would arrive around 6 in the morning, would wait around for the neurosurgeon to come, where they would install these bolts in the patient's head. They would get some sort of CT scan, a plan would be created, and hours later the patient would finally make it into the room for treatment. Treatment might take 45 minutes to an hour. If there's multiple lesions, you can add time to that equation as well. So it used to be a full day process, and the patient had to walk around with this halo and bolts in their cranium. With a line RT, it takes a lot of that invasiveness out. If you're a patient, you don't have to get the bolts in your cranium any longer. You're treated with an open mask, and that open mask can be created in a half-hour session on any day before. So on the day of actual treatment, you arrive maybe around lunchtime, you come in, you lay down, nice comfortable mask is placed on your face, and in about 30 minutes, depending on how long it takes to deliver your treatment, you're in and out of the room. So our primary application a lot of times is breast, SRS. We're starting to rise in numbers in the head and neck field as well. Head and neck cases, they have a lot of mucositis. So when they're laying down flat on this hard table, a lot of times they have the drainage in their throat causing them to move a lot, and the industry standard is to immobilize them completely, their entire face and their shoulder area, and then you can't really see what's going on motion-wise during treatment delivery. So we're working with all of the major mask vendors and creating much more comfortable open masks so patients can actually swallow if they need to comfortably, and it reduces their chance of claustrophobia. And we're there to monitor them if we need to hold the beam, if they need to swallow, once again, increasing patient comfort and getting patients in and out of the room much quicker. And every patient, every time, really. Head, shoulders, knees, and toes. I've seen customers use this to align a foot. It's a very flexible product, and there's a lot of work that can be done still to make it solve even more problems in the clinics that we haven't even thought of yet. And so hopefully you'll join us to help us come up with those new solutions for the future.